William, hopefully your favorite videographer from Two Hats Publishing. I welcome you to another Two Hats special of community events. Let's look in and see what's really happening.
And good afternoon, and welcome to Lambda Weekly. Patti has a new excuse. She's running very late because she was busy working on Aaron's campaign, and we understand. So she will either screech in here at 2 o'clock or next week. I think it'll be next week.
I think we'll see her next week.
So our guest today is Stephen Pace. He is the executive director of AIN. AIN used to stand for AIDS Interfaith Network. It now does not, and I never remember what it stands for. Yes, I do. Access and Information Network. I am so glad, Stephen, that you kept those initials because now here's the interesting statistic. While Don Mason was the longest-serving director of an AIDS organization anywhere in the country when he retired this month, Stephen is the longest-serving director of AIDS organizations anywhere in the country, as far as we know. There might be somebody in some city somewhere, and we just didn't know that that person has been running their AIDS services since the mid-'80s. But, Steve, when did you start directing AIDS organizations? Early in the AIDS crisis?
Early. There weren't AIDS organizations at the time that I first started working with HIV. And in those years, a lot of us were just scrambling to try to do something. So
just filling in wherever we saw somebody needed something.
Yeah, I came to Dallas in the late 70s, around 1980, and shortly thereafter, HIV came to Dallas. And I'd come here partly to change my life and to have a different life. So I went from corporate into the church, which I never expected to do. But so I was a young minister finishing up education and doing internship with Metropolitan Community Church of Dallas at the time, which has since morphed into the Cathedral of Hope. And by virtue of that being there, when HIV appeared in Dallas, I met some of the first people who were diagnosed on, and the first person I ever visited, when I sat down by him and took his hand, he began to cry and just said, "Nobody has touched me in months. Everyone is afraid of me, and I've lost my whole life because of that." And so shortly thereafter, I was called to meet with someone, but he was so far gone and had just been dumped at the old Parkland. And when I went into that room, there wasn't anything I could do. But in both of those instances, they became defining moments for me. And the first person, as I held him as he died, he said to me, "Do something. Use your life. Don't let my life and death now be in vain. Do something to stop this from happening to other people like me." He was in his early 20s. And I knew from all of that experience that it's that thing that says you're going to be in this in some way. I didn't know what way, shape, or form that would take. So, but those words still resonate with me today that said, do something. Use your life. And I have proceeded to do that for the last 37, coming on 38 years.
So that people really understand what it was like at Parkland at the time, Dallas Gay and Lesbian Alliance had to sue in order to get them to even administer drugs to people with HIV. I remember walking into somebody's room one time and I said, "Is there a reason your lunch is sitting outside the door?" And he said, "Yeah, they won't come in here and serve me."
I had that experience hundreds, if not a few thousand times in the early years, and going there, and advocacy at that time, you could not be involved and not be an advocate because people were being treated, just left even in the hospitals. There was so much fear, so much stigma, and people were not getting anything. I stood in those picket lines at times to picket, not to pick on Parkland, but
well, actually, the administration of Parkland wanted us to sue so that it would force the county to fund
to do something.
Yeah, to do something, to fund the what was needed for care, and to fund the drugs, which was only one bad drug.
So just to give our listeners a visual, they would admit these patients in, but basically stick them in a room and don't do anything.
No one would go in.
Right.
They couldn't get nurses, even doctors at times, to go in, and food trays would be out in the hall or on the floor.
Now it wasn't that nobody would feed them, it's that some of the staff wouldn't, and so they'd leave. So somebody else would come next shift, and or even on that shift, and say, and bring the food in. I mean, it wasn't that they were being starved to death, although in some cases. I mean.
Same thing with, I guess, administering the medicine. They would just leave it outside?
Well, there wasn't really medication. It came along, AZT especially, but there wasn't. We didn't know very much. Right. Nobody knew very much at the time.
But they were treating some of the infections once they figured out what they were. The reason that Resource Center was illegally administering pentamidine mist to prevent
pneumonia,
pneumocystis pneumonia, was because they didn't want to do it at Parkland.
So, like a lot of people at that time, I began to try to find other people who were willing to do something, and started to connect with everyone who was gathering up food. And of course, through the church, we were in the midst of the community, the political action that was trying to take place at the time, and groups that's where Oaklawn Counseling Center entered the picture. They had just opened that center. Howie Dare, now the Dare Center, its namesake, they had opened that, I believe it was about 1981, and then Oaklawn Counseling Center then kind of expanded on their name ultimately to become Oaklawn Community Services, so that they could do more than counseling, and opened that up and became one of the premier and largest HIV/AIDS service providers in Dallas at the time. But it started.
And we were talking before the show that it's gone 20 years.
Yeah,
It's 20 years since they're gone.
I worked with some of those early efforts for that. I worked with early efforts that became AIDS Interfaith Network, with early efforts that became the food pantry that ultimately is part of the Resource Center, early efforts that became AIDS Arms, which is now Prism Health. I was in a lot of those, and of course at the time, as a young minister who was willing, which so many churches were not, I was doing funerals and memorials almost every day of the week, and sometimes multiple times per day. So it was a very different time in history of HIV.
I mean, one of the things that kept the Voice going at the time was the funeral homes that advertised that they would do an AIDS memorial service and burial, because even after the person was gone, they wouldn't handle the person, even though the science at the time did show that you could not catch AIDS from somebody who is not alive.
And for the longest time during those years, they would do cremation,
and that was it.
Not embalming. But many were the times too when you didn't know what ultimately became of people, because you didn't have any rights as family, of course, so they couldn't tell you, and the person would die and then disappear.
Yeah, I had a couple of friends who the parents swooped in, took them home to wherever. That was the last we heard from them.
Yeah.
So back in those early days, before HIV even had a name, what was it called first? The
GRID,
right. so the science wasn't clear about how actually it was transmitted. What made you, I guess, risk? Now we know there wasn't a risk, but at the time, what made you say, I'm still going to go in, touch, and help these people?
You know, I've asked myself that so many times and relived those moments in my life. And I think at the time, my faith was a piece of that. And this was a human being, and I had breathed the same air, I had been in the same room, and there was still, though, that moment when I actually took that person's hand, because at the time there was so much suspicion of touch and air, and I thought, if it's air, I've already
You already have it.
I mean, this is so. But when I took his hand, that was another big thing, and so in that moment, I sort of froze midair, and I thought, inside my head, I had this battle going on, but all of a sudden I just said, this is ridiculous, take his hand. And wherever that came from, I think, is that spiritual place in each of us, whatever you call it, whatever you term it. But for me at the time, for where I was in my faith, it was that moment that said, this is a human being, and you are here to serve this person and to reach out as another human being. You're talking about humanity and dignity and inclusion, and this person is here, and you're the one who needs to take his hand.
You know, the other thing, Lerone, at the time, we figured out pretty quickly that it was sexually transmitted.
Yeah.
And
Or bloodborne.
Or blood.
Or bloodborne, right. And taking somebody's hand, even mopping up when somebody was bleeding. You're not going to get it all over you, so you're a little bit more careful with, with cleaning up. And that's when wearing gloves became common, to do something medical or whatever. So on a logical level, it wasn't that hard to discount the people who are being really horrible to people who are dying of AIDS.
Well, for the hospital doctors and nurses, that to me that there's no excuse. That's what you're in that profession for. There's a risk. You're treating people with all kinds of diseases, but when you have somebody who's not in that profession, such as Stephen and others who came to help, I was just wondering what made them do it.
Well, I think again, just from that place, and just when I decided this is something that I need to be involved in, and something that I can do, and even now, I don't even know where that came from, except I think not unlike other gay men at the time, I think a lot of us assumed that it's lurking there somewhere. I didn't live differently than my friends, but I had the assumption, I know, that for the longest time, a few years, that the next test would turn up positive. And I was tested hundreds of times to get other people to go and be tested, because at first testing was suspect. Don't get tested, because it was everything from being gay to poppers are the problem. So, but then when that shifted, then it took a lot of us who would be willing to go do it, and even do it publicly. And I kind of held my breath each time, thinking, well, is this going to be the time?
Well, and understand at the time they were talking about, maybe we should have concentration camps for all gay people to stop the spread of this disease.
This isn't funny, but I just want to share this kind of funny anecdote. When I was this was all taking place when it was really starting to make the news. I was in 5th grade. And
he was in 5th grade. Do we want to kill him?
No.
But I knew I was gay, even then, young. And I remember a group of my friends were talking, and one of my friends was like, my mother said, if you're gay, you already have it. You just have it. So in my mind, I was kind of freaking out that I had this dreadful disease. But it's just, what people thought at the time.
But that's the kind of misinformation that was out there.
That's it was.
Even the dumbest of the doubters or of our enemies out there who were not interested in helping knew that you weren't born with it unless your mother had it.
Right.
So,
How far have we come?
Really, truly.
well, there's still people who, with all kinds of conspiracy theories about it,
And the stigma is still
It's still there.
very much there, yeah. Particularly across the plethora of communities that are disproportionately impacted by HIV. It's
So when-
still one of the challenges that in education and educating about HIV and even STIs today.
So when AIN first formed, Resource Center was already there as the AIDS Resource Center, and they were doing a lot of the education. They were doing what else? The pentamidine mist, although that was later in the 80s. They were what were their original? I guess originally it was formed as an information place. People had nowhere to call, because I remember sitting on the phone lines there sometimes and explaining to people what their positive diagnosis meant. And people would just walk into the AIDS Resource Center just to get information, to pick up condoms, things like that. OLCS was doing a lot of counseling. That was maybe their main thing. In mid-'80s, they formed the DARE Center.
Yeah, they formed a variety of services at OLCS, and they were heavily involved in prevention work at that time as well. But when the DARE Center formed, Howie left a concept for that, and he died earlier on, but DARE Center was formed and then actually implemented by 1988. And it was an adult daycare with the intent that, especially for gay men, that if you had a partner or someone who could drop you off there on their way to work and then pick you back up at the end of the day, and you'd be safe. There was people to take care of things. You had meals, and DARE Center was an inclusive, all-inclusive site. It was but of course the population at the time was predominantly gay men. Even though it crossed racial and cultural lines, it still was predominantly gay men. So the thing I've always loved about the DARE Center is that it has been able to adapt and change, and it's essentially still can be exactly what it was in the beginning. But backing up a little bit.
Hold that. We need to take a break. And I have a funny story about Howie Dare also. But you're listening to Lambda Weekly on 89.3 Knon FM. I'm Dave Taffet here with Lerone Landis. Patti is running extremely late. And we'll have more with Stephen Pace from AIDS Interfaith or from AIN, formerly AIDS Interfaith Network, right after this.
It's Rollins Gilliland, and I'm listening to Lambda Weekly on 89.3, and darn glad to be doing it.
And this is Lambda Weekly. I'm Dave Taffet here in the studio with Lerone Landis. Our guest is Stephen Pace. He is the CEO of AIN. AIN was formerly known as AIDS Interfaith Network. They went to a more, I hate to call it just generic name, but changed the name, took the AIDS out of the title because they do so much more in the community than that. We were talking about one of the early programs from that started at Oaklawn Community Services, and when that organization went out of business, became part of AIN, and that's the DARE Center. The DARE Center is an adult daycare center, and the idea originally was Howie Dare was Candy Markham, who's on our show regularly. Her partner in crime was Howie, and Howie had this idea. He wanted to be able to see his friends cared for safely without the partner having to quit his job. So they created this, and Howie never lived to see it. They created this daycare center that people could come, and there would be activities, there would be friendship, and there would be food, and if there was a medical emergency, somebody could get him to the hospital, just all that stuff that you needed. And what am I missing from that?
No, just that was the basic concept, and that's exactly what was implemented. I went to work for OLCS in the early mid-90s and was director of HIV services. So the programming that they did, which encompassed mental health counseling, substance abuse treatment, HIV education and prevention, transportation services, the DARE Center, and casework. It's a whole combination of services. So when OLCS went into difficulties and then had to close at the end of the year of 1999, I was the architect of moving and all of the HIV programming to other places. Well, the mental health and the substance abuse treatment became part of what is now Legacy Counseling Center. And then the other 7 programs have moved to AIDS Interfaith Network. And so I was the architect to put all of that in place. And so as over the years now, and that was 20 years ago, because now I've been with AIN for 20 years, soon to start 21st year. So, and the DARE Center and all of those programs still survive and are still active and still serving people today. In its current concept, we've put more emphasis toward wellness and helping people sustain their lives in treatment and live better with HIV. Because the people who come to the center are also, out of the 2,000 we serve, there's nearly 500 who are eligible for the DARE Center. Thankfully, they don't all come at once, because we'd never make it if they did. On the other hand, the center is able to accommodate a range of people who are there for such a big variety of needs. The centerpiece is still the nutrition, and it gives people a safe place, and it helps with stabilization in people's lives, and helps give them a place to build off of. If you
I was going to say, and one thing that occurred to me is that since 1999, before that, originally the DARE Center wasn't managing people's medication, and staying stable on your medication if you have no place to go during the day isn't going to happen.
It's very difficult. So one thing we do at the DARE Center, and have done forever, is normalize all that. You bring it with you, you check out a locker, you can stow your stuff safely, and throughout the day, beginning with breakfast, people take their meds, and they manage those meds themselves, but they have a safe place to put them during the hours that they're there. And so, but it normalized all that as well, because most people are carrying around a pharmacy with them, and that's still true for a lot of our clients today.
During the break, we were talking about how many deaths that you all had to witness in the thick of it. But now, due to the amazing advancement in drugs, it's been a lifesaver. So you don't hear about people still passing away from AIDS these days. Do you still see? Do people still die?
They still do. Not as often, certainly. We used to have death every day. We even made a ritual out of closing someone's client file and putting it to rest in a certain place, because, again, a lot of times we didn't know what became of them in the end. But it still does happen. It's just not nearly as visibly and not as often. Treatment, to give you a stat, of the 2,000 people living with HIV that we serve, a little over 50% of them are now 50 or older. 50% of that number are pushing 60 now, which means that they have been living with HIV now for 20 years or a little more. So they may not have been a client all of those years, but they've been living with it. And now, so treatment has changed everything and has changed people's lives. But the critical thing is being able to stay in treatment, and because treatment is also prevention. But staying in treatment, if you have a lot of other needs in your life, so which transportation or some of the other things that we do and that the system of care here in Dallas can provide you've got to meet those needs. If you're starving, you're not going to go keep a doctor appointment. You don't even really understand exactly why you need to do that. If you don't have any place to live or you don't have any place to be, how likely are you going to be able to keep up with these complex regimens of HIV treatment drugs? I mean, everything is connected, so you really have to make sure that services kind of follow that same kind of pattern, that one helps support the other. That's why collaboration, as we all do with all of these organizations now, and I think that we're especially very good at that collaboration, because we're an agency that are referred to by all the other agencies, and a lot of times for at least one of our programs, which is the largest, is transportation. So David has mentioned that it was AIDS Interfaith and then AIN. So can I talk?
Sure.
Yeah. Why did the name change?
Well, AIDS Interfaith was originally formed to be kind of an outreach, inreach to the faith community. And it was just to garner a better, more compassionate response, because like it was with medical and everything else, and it's this way in epidemics that followed the same pattern, the church shut its doors to people out of fear, out of stigma, then you added the stigmatization of being gay on top of that. So the church really turned the other way. AIDS Interfaith came about to shift that.
And you know, one thing that I remember from that period was there were good people in good churches who wanted to do something, but what do I do? Just walk into a hospital and start treating people? You know, I can't do that. And they needed somebody like you there to tell them, here's how you can help.
And AIDS Interfaith created a program called Care Teams, and it gathered up people from churches, whereas OLCS created the Buddy Project, and it gathered people from the community. So they gathered up people, and often these people could not tell anyone that they were involved in that. They sometimes wouldn't tell their own families that they were involved, because there was so much fear and stigma, again, with touch, with other things. So these care teams was our first program, and they were very important in the early years of the history.
What are some of the things the care teams actually did?
People came to homes or apartments, and they filled in everything. You know, they cooked, they cleaned, they did the laundry, they went to the store, they got people to their appointments if they had appointments to go to. They did it all, and sometimes around the clock. They would tag team these groups and assign a group. That's why you had to assign small groups, because it was more than any one person could do. And these people were incredible at that time, and they felt, and that was again in the formation years, before there were organizations to do that work or to provide a program that does that work, and before medical treatment and care became more refined. Then somebody had to step in, and it was these small groups of people, like in these care teams, who did that. So when we transitioned the OLCS programs to AIN, it changed the scope of AIDS Interfaith, and so all of a sudden we were a comprehensive HIV/AIDS service organization, and we still are. And that was the thing that we wanted to get across in the name change. We, like so many organizations over the years, you mentioned AIDS Resource Center. AIDS moved out of their name a long time ago, and Health Services of North Texas was AIDS Services of North Texas. AIDS Arms became Prison Health. Sure. Many AIDS organizations over the years have made these shifts, and you know, HIV and AIDS was used synonymously for forever, I think, from the same, and they're not the same thing.
They're not the same.
To have HIV is not to have AIDS. So AIDS has always had, as much as we're not trying to demonize the word, but even CDC and the World Health Organization has really pushed to move away from the use of the name. We like so many, moved toward our acronym, AIN, and that's how we became branded in this last 6 to 8 years, most of what you would see in print or anyone would talk about us would just say AIN. And a lot of people didn't know what it stood for. But you can't put a sign on your space that has AIDS in the word. It's difficult now with younger people who are being diagnosed to walk into an organization who AIDS is the first word in its name. It's because they're facing a new diagnosis that they're still grappling with, but need services, and the word confronts them in a way to be the thing they don't ever want to have happen.
During the height of the AIDS crisis, you would move from having HIV to full-blown AIDS, meaning a diagnosis of 200 T cells or less, and having had an opportunistic infection, usually within a year of that diagnosis of HIV. Now somebody who's diagnosed in their 20s might not have any kind of opportunistic infection throughout their lives, and somebody might never have their T cells drop to 200 unless they're being treated for something else along the way, and they have to stop their medication for a period of time, but then it can be boosted again. So it is a different diagnosis now.
It is.
That you don't want to walk in, and they still might need some help for something.
And so by broadening the name, it also broadens. Now we kept our acronym, we kept our mission, our purposes, our core values, and our vision. All of that remains the same at this time. Our mission, we opened it up a few years ago, just by adding 3 or 4 words to the end of it to say, and other vulnerable populations. So if the time comes, or as it comes, we can do more. But with the range of programs that we do now and the purposes that we have, we needed to do something else. And it's interesting with fundraising, because we rely heavily on a combination of government grants, but we still have about 1/3 of our budget to raise from other sources. A lot of places, foundations, different things, say that you can't get them past the first word in your name. So if you can't get them past AIDS, we don't fund AIDS. Well, then we'll look at some of the things we do. Do you fund any of these things? But if you can't, you have to get past the first word. So then in the same way in the second word, in interfaith, faith, all these words were always came with a mixed reception. On the one hand, what very much value and faith undergirds still our core values. It's the foundation that our whole organization rests on. On the other hand, we've never been part of a denomination. We're not funded by a denomination. You didn't have to.
Your name says that. It's interfaith.
Right. And it's but those assumptions are different. And also it raised a question for people coming to us for services. Well, what do we have to do to get services there? Is there an expectation, like there is with some religious organizations, that you have to do a certain thing or be a certain way or embrace a certain belief system? That's never been the case with us, but you have to get all that assumption out of the way. And I know we struggled with the name change for several years. Our board, we went back and forth over it probably for 7 years or more. And last year, we were facing this relocation, and it's like, we finally need to come to grips with this name change. And so we made it all happen, and it's been a good change for us, because once again, I always say we're still AIN. We've been AIN from the beginning. We still are now, and we will be in the end.
And we need to take a break in a minute. You said fundraising, and I do want to mention, before we've run out of time, and we don't mention, Blumenball is one of your biggest fundraisers of the year. It's going to be held on June 1st at the Renaissance Hotel, which is right on Stemmons Freeway across from the Anatole. It's the big lipstick building. It starts at 6 p.m. It's in the Grand Ballroom. And tell us a little bit about, you have a silent auction. Tell us a little bit about Blumenball, though.
It's the Bloom and Bowl is the largest fundraiser that we directly produce. So, yeah, it is. It's a seated dinner with a silent auction, and then during the dinner there is a program, and the program includes a client presentation. So, one of our clients speak directly to their experience. Then there's a service auction where we actually assign a dollar value to services and sell them like a live auction would be. There's a wealth of entertainment, music, especially,
and a religious service.
And we give the Crystal Hope Award, and this year last year I was the recipient from our board of a Lifetime Achievement Award, and we're turning that into an award for achievement in humanity that will be given by me this year. So and then there's an after party until the silent auction closes. So starts at 6 to 7 is VIP, but the silent auction opens at 6. Dinner at 8, concludes about 10. The after party starts and runs till midnight. So,
and there is no religious component
there
to
is
this
no religious
whatsoever.
component.
Okay, we need to take a break, but I want to tell my Howie Dare story. He lived across from me in our condo complex, and it was a small condo complex which is still there. It's right it's on Dickinson in Oak Lawn, small complex. Anyway, Howie decided to put in a hot tub, and his back door faced out to the pool. I lived across from him, and I guess he and I were the two that hated our condo association. And so he just decided he was going to put this hot tub out there and enclose it so that his condo, it kind of doubled the size of the condo, taking part of the pool. I didn't care, and neither did most people. He ended up moving to one last place before he passed away, but that was about 1981 or so just a couple of years before Howie died. But he was a character. So, and I like to remember him that way, as opposed to, when he got sick. You're listening to Lambda Weekly on 89.3 Knon FM. I'm Dave Taffet. I'm here with Lerone Landis, and Stephen Pace from AIN is our guest. We'll be back with more right after this.
Hey, this is Valletta Lil, and I listen to Lambda Weekly. I hope that you will too.
And welcome back to Lambda Weekly. We're talking to Stephen Pace, and he is the CEO of AIN. We were talking about a couple of your programs. I want to go back to the Dare Center. You just moved, and the new Dare Center is wonderful, has a formal chef doing the meals now. Boy, have things changed.
Yeah, we've had a chef, though, for several years.
Yeah, I'm talking top level, who could be at any restaurant anywhere in this city.
Her name is Dawn Knowlton, and she's been with us year and a half, maybe 2 years by now. And yeah, she has stepped it up. We work with guidance from a dietitian consult to be sure that the food that we're serving meets the dietary needs of people living with HIV.
You know, originally, people with HIV, because of wasting syndrome, had to have a high calorie diet. Like if normally you eat 2,000 calories, people with HIV needed 4,000 just to not waste away. What's different in the diet now?
That, for one, you don't see wasting as much, and with people living longer, now you're starting to see all of the other attendant issues, everything from heart to diabetes. So nutrition has become even more critical, I think, now, and to control calorie and yet get the nutritional levels that you need, being conscious of the fact that people are managing all of these other, and with long-term diagnoses and aging with HIV, you introduce a whole lot of other health management issues. So your nutrition is extremely important depending on the regimen of HIV medicines that you're taking.
And on some of the some of the medications themselves might play a part in that.
They do. The long-term effects of long-term HIV medications, I don't think that we still really fully know what those effects are. And I know in some cases we're starting issues and those kinds of things emerge as well. So it's never been just HIV, but it's not just HIV to be conscious of. And so in trying to create a nutritional program that meets those needs. So yeah, it's not just fattening people up.
Well, one of the other programs that you do, I think, is probably one of the most important ones, and that is the transportation program. Yeah. People have to have a way to get to where they need to be.
Nothing comes to you. You have to be able to get there, and our transportation program does that. We have a relationship with DART, so we purchase tens of thousands of bus passes per year from DART, where the transportation program constitutes just about half of our total operating budget. And DART purchases alone run between $620,000 and $700,000 a year. And that's just to purchase them. So we don't charge clients for any of our services. If they were in a position to pay for them, they wouldn't need to come to an organization like us.
It costs more to get there and with their time than it's worth to get the pass if they don't need it.
Right. So we're already dealing with a population that's highly in need of those of that support. So our transportation actually has three parts. So the majority are using the DART because those passes are good on buses, trains, and TRE. So wherever there's DART service, and if it's accessible to you and you're able to use the public system, it's a good thing because most of the time we're able to give you a pass that provides unlimited rides per month, so you can manage all of your care and all of your needs. The second part of transportation is we have a fleet of vans, 4 minivans, and then one bigger bus that is up to a 3 wheelchair capacity. So for those who cannot use the DART system, maybe it's not accessible, or there's mental health or mobility issues, or DART's not close enough by, for all of those kinds of reasons, and we provide door-to-door pickup and take you to your appointment, pick you back up, and bring you home.
Yeah, when you say DART might not be nearby, you serve more than Dallas County.
Right. We're concentrated in Dallas County because more people with HIV live in Dallas County. But we like for instance, 3 of the other counties, Ellis, Navarro, and Henderson, we make a van loop through those areas, and people who live in those areas can attach to that transportation service if they need to come into Dallas for treatment or care or other services. Then we partner with other organizations who are focused in Denton, Colin Hunt, Rockwall, Kaufman, those areas, and even up in the Sherman-Denison areas, because it takes all of us, and the geography is so big. We're part of a 12-county federal and state region, so we're, like I said, most heavily concentrated in Dallas, but we do link up with all of these other counties. And for instance, with the expansion of DART, if someone in another county, north or south, can get to a DART station, then we can be their provider to get them DART passes to come into Dallas County for care. That still is a common need for people to come into Dallas County for care. And other counties have it to offer, but sometimes not the complexities of it.
How do some of the clients in these kind of faraway counties even find out about you all? Is it an outreach, or does somebody refer them to you?
It's part of both. There are organizations like in Denton, Colin Hunt, that area, the northern areas, Health Services in North Texas is kind of assigned in that area, but And so between us all, it's another part of the unseen work that goes on constantly, is this outreach to put information out there in publications and get information into communities, finding out where people gather, where do people get information, trying to put it there. Social media has become more and more and more key to spreading that information as well. And then, like earlier I was saying, that clients can initiate services with us, or we can be referred to if they are initiating somewhere else. And especially testing sites, you have to be sure that they're aware of who's the provider that's closest to them. And of course, with the medical providers, a lot of times people end up with medical care first, but then they have all of these other needs. So the medical provider is going to assess them and maybe refer them on as well. So it's a collaborative, cooperative combination of efforts every day that to help people find you and get what they need.
Now, years ago, if you lived in Navarro County, you couldn't find a doctor to treat you for HIV, wouldn't know what to do. Are you finding that's still the case, or does an infectious disease doctor finally understand this disease enough to treat somebody?
I think that's still the $64,000 question. If I was a person with HIV, would I trust that the local doctor, even an infectious disease doc, would I trust that they have enough knowledge about it? HIV is still a specialty, medical specialty, especially longer term care. Even if you start in locally, and there are some, yes, I don't mean to sound like, and I'm not being critical, I'm thankful for any doctor in any rural county who's even willing to see someone with HIV. But the question is very much that, and I think the medical profession is grappling with that, even as they try to decentralize care and push it out into community clinics and stuff.
Now, I can see somebody who is a doctor, has only seen a couple of HIV cases. I can manage it with you, but, I'd really like you to go up to Dallas, go to Parkland, and we'll make an appointment. I want them to double-check my work. It is only the second case I've seen of this.
Right.
So there might be some of that, too, where they're trying to provide the care, but
just
and want to provide the best care and want a second opinion, which...
Yeah, and HIV meds are changing every day. New things come on the market, and so for an HIV doc whose specialty is HIV, you have a lot to keep up with, and of course the paying, the ability to pay is another issue. If you don't have a payment source, it makes your healthcare that much more complicated.
Oh, so in some cases they might need to come to PRISM in order to take advantage of one of their grants to provide the drugs.
To PRISM or Parkland. In our case, the majority of our clients receive their care through Parkland.
Through Parkland, yeah.
And but certainly PRISM, AIDS Healthcare Foundation, those who have medical care to provide and have grants that overcome the inability to pay. So, but it's a lot to learn for a newly diagnosed person who maybe it's never been in this position before, or who is young and hasn't really dealt much with the healthcare system. It's a complicated system, and some young people have not, until the last few years, maybe haven't even thought about having insurance and what's that going to look like, or they're suddenly in a situation where they might have to look at Medicaid or some other source. So Parkland's been the safety net hospital for and HIV treatment for all of these years. So, but treatment is now becoming more widely available. But the question of a payment source is still a big question.
I wanted to talk a little bit about family before we wrap up. So we're talking about, back, in the thick of it, how even medical professionals were not even going to rooms with HIV and AIDS clients. And so we heard of the horror stories, families wouldn't even go to the funerals, basically disowned them. How has that changed? Has it gotten a little bit better as far as supporting their loved ones through the care? Because sometimes I would think that sometimes a family member may want to help, but they don't have the means to do it also.
It's changing, and it has been changing. And frankly, I always try to see the optimist view. I believe it's changing for the better. But if you're a person with HIV, I can't tell you and when to come out about having HIV and who did it. I can suggest and I can tell you what I think would be better. And I think the sooner you can tell someone and start to share that, don't carry that by yourself, and sometimes giving families the opportunity to step up. Because most of the time, they're going to have to be educated to it. It's outside the scope of experience, just like it was even for everyone early on. So being able to provide some information and education as you're in that process is part of it, or help your family get to that information. But the biggest thing is if someone tells you you have HIV, that's a big thing. It is still a big thing, and it's not necessarily going to be received as good news. And so I would just encourage anyone who's struggling with that to, first to be tested, find out your status, and if you are positive, get into treatment and share that information. Find someone, start there, and then share that information, because the burden of that can really, and it can immobilize you. Your own fear, the heaviness of that information can immobilize you, and that's the last thing you need to do with that information. So getting into treatment, getting into care, building a support system, and finding people to make up part of that support system.
Just before we go, so you do case management?
We do intake, we do case management, medical case management as well. We also provide linguistic services, which is Spanish language interpretation and translation, not only for our clients but for the system, for other organizations. So we often translate materials for other organizations to be sure that language is not a barrier anywhere you go if you are Spanish speaking. Of course, the transportation, the DARE Center, and the meals program. And then on our other side is our health education, HIV education, and prevention programs, the outreach, testing, and linkage to care. And so we reach beyond 10,000 people in that part of who we are. So,
and in Dallas County, they estimate about 18,000 people is the latest number that I saw who are living with HIV. That's just Dallas County, doesn't include Collin.
Yeah, and there's somewhere in the range of 5,000 to 7,000 people that are probably in need of some amount of access to this system and some amount of help with the costs of care. So a lot of people are living with HIV, working full-time, and doing that very well, and just having HIV doesn't necessarily mean that you're going to need to be in these kinds of programs and services. Can I tell people where to reach us?
And go
to our website, especially at AINDallas.org. You'll find everything there, all of the information we've talked about, the programs, the access, the numbers, who, the ball, and any information about us, and how to donate.
We know about those donations, don't we?
We do.
We just finished up a pledge drive. Steve Pace, thank you
so
for
much
being with us.
You're
and
awesome.
Congratulations starting your, 50th year or something like that?
Really, 38. Thank
30th.
you. Thank you.
For all of us here at Lambda Weekly, we'll see you next week, and be best.
This is is William, hopefully your favorite videographer from Two Hats Publishing. I hope you enjoyed this video. If you like it, please leave comments below, or like, follow, or subscribe to us and get notices of all our videos. We love it, even when you call.